So with that, I want to talk a little bit about size. So that was, our first piece was enhancement, and you saw a little bit of growth with Hamzavi dermatology. But why does size matter, especially in this day and age? Because we talked a lot about the consolidation that's happening in the market. As the market continues to consolidate, as private practice physicians, if you're not proportionately growing, you're just unfortunately being left in the margins and being more marginalized than you would probably like to. So there are varying levels of clinical and financial integration in these different types of entities. And so we'll talk first, for example, about independent practice associations, which we've talked a little bit about tonight, where there's a lot of independence within the private practices that are involved with these, and there's not as much affiliation and coordination. And thus there's certain cons, such as you don't have access to capital as much, you don't have as much coordination, and even things like we were talking about earlier, there's no consistency, if you will, across the way. Each and every practice might be going in their own direction. Then you have physician-hospital organizations where they're more aligned with the hospital, so you have a little better alignment, which creates a little bit enhanced coordination and efficiencies. But at the same time, you have challenges with governance and control because you're still kind of autonomous in your own ends. Further, you have the supergroups and we'll talk a little bit, we'll do a case here momentarily on the pros and the cons and how you set up a supergroup and the case around that. But supergroups tend to be kind of the latest trend, if you will, for private practice physicians, because it's an opportunity for the physicians to really maintain a lot of the independence that they've grown to really like and be comfortable with. Further, they're able to expand their patient set and share those patients across a group, whether it's single specialty or multi-specialty. And in addition, they're able to be more efficient in their cost structure typically because they're able to leverage their infrastructure. But at the same time, there are certain constraints in terms of as they're getting bigger, there's lack of ability to be as nimble and as quick moving as you might be when you're smaller and make your own decisions. And that's why governance tends to be a big important factor as these supergroups are set up. And then finally, you have probably the highest level of integration of clinical and financial is the integrated health systems, which is really kind of the one-stop shop where you have your captive patient base, you have the full continuum of care from inpatient to outpatient, you have typically better access to infrastructure and capital. But the challenge here becomes, and the con becomes, it's so big, it's overburdened administratively, it's not as efficient, there's a lot of redundancy happening. But the key thing with all of these is they're able to, at some point or another, formulate how they engage with accountable care organizations. So accountable care organizations are something that are here to stay, and we have many people in this room that are probably involved with them in one form or another. But ACOs allow the ability to any of these groups or players within these groups to potentially join or even eventually evolve into an accountable care organization in which they're able to share the risks and the rewards. And obviously there are a few different types of programs out there within ACOs, but it's another management or system that will allow certain flexibility and allow, hopefully if it's done appropriately, financial reward and incentive to the physicians involved.